More than 3 decades of unprecedented rapid economic growth has made the world more prosperous than at any time before. A revolution in information and communication technology has at the same time made the inhabitants of the world in closer, direct contact with each other in a manner that was totally inconceivable only a few decades ago. I think the fact that we all share and have a common stake in the same world is no longer an abstract notion, it's a daily reality. Yet, increasingly large numbers of people have been left by the wayside. Never before have the fruits of economic progress been so unequally divided as they are today. Almost half of the world's wealth is now owned by 1% of the global population, while millions of people live under an endless daily struggle to satisfy even their most basic needs. Michael Sisson said the other day, "The world's not a fair place." I think it's an understatement of the day perhaps, but it's true. Increasing inequality has weakened the link between economic development and improving living standards for those who live in poverty. In many countries there's been an impoverishment of the middle class, and economic crisis has marginalized large parts of the population, not least the young, who face a bleak and jobless future. There is nothing inevitable about this development. It doesn't result from any law of nature or even law of economics. It is a result of the policies that have been pursued. 20 years ago, I was in Moldova at a time when the economy of this newborn country was in free fall. Wages had fallen from quite comfortable levels to no more than $10–15 per month, and were paid half a year late, and more often than not in kind. For most people, life had suddenly become a nightmarish struggle for daily survival. I got somehow involved, I don't quite remember how, but in a donation of Romanian school books, and the international organization responsible for executing this donation, I won't say which, insisted that the parents should be made to pay for the school books, because they must learn that there's no such thing as a free lunch. Well, times have changed since then, and hopefully also attitudes. Still, it's less than a decade ago that Dollar and Craig made their epic statement, "Growth is good for the poor," period. Blind belief in an unfettered rule of the market and in trickle-down effects has guided policies and politics for a long time, and has caused a lot of harm, mainly to those who were furthest away from their decision-making. Economic, social, and political inequality go hand in hand, and they tend to reinforce each other. Money talks and buy politics, thus undermining democracy. The unemployed soon become socially marginalized, and the socially marginalized find that they have few economic opportunities. Economic and social discrimination also tends to come in pairs. Economic and social policies are inexorably intertwined. Yet far too often they're treated as if they belong to two completely different worlds. I think decent work is perhaps one of the few areas where the spheres of economic and social policies really do come together. To reverse the trend of increasing inequality, those who find themselves at the bottom of the economic and social ladder need to be empowered. This requires addressing and redressing economic, political, and social structures to ensure that the interests and rights of those living in poverty or are marginalized in other ways are allowed their rightful role in shaping society and in making development inclusive. It requires a combination of social and economic policies that put productive and decent work at the fore as a main vehicle for achieving inclusive and sustainable development. It also requires the development of universal social protection systems as an important development tool and as a complement to productive employment, and not least as a human right. It can be done. It's been done before. It's a question of political will. It's also a question of knowledge of social and economic processes, what they look like, how they develop, and how they can be influenced and formed, and how they can be shaped by policies. UNRISD has played an important role as a main creator and disseminator of such knowledge for a long time, and I'm sure they will continue to do so for many years to come. And the Swedish International Development Cooperation Agency, SIDA, that I represent, has for many years been a partner in this and supported UNRISD in this important task. We have 4 distinguished participants in the panel today on new directions for social policies, and I think we are all looking very much forward to a very interesting and fruitful discussion. Thanks a lot.
Thank you. Thank you very much. I think that's really helped to set the scene, put in context the big challenges that we face today. So let me turn and introduce very briefly. They have very long biographies, CVs, so I'm going to be extremely short in introducing all the members of this distinguished panel. First of all, Jimmy Adesina, who's a professor and chair of social policy in the University of South Africa, and is also a newly appointed member of the UNRISD board, but has worked with us in the past on many of our social policy related projects. So welcome. Our second, not the order of speakers, but on my right, is Michael Cichon, who is now the president of the International Council on Social Welfare and a professor of social protection at Maastricht Graduate School of Governance, and of course very well known to many of us in his former role as director of the ILO Social Security Department, and really the driver and architect and instrumental in getting the social protection floor recommendation into a recommendation. I then have Rana Jawad, who's a lecturer in social policy at the University of Bath, has worked on many issues of social policy in the Middle East and North Africa, MENA region. And really, as she pointed out in our workshop quite kindly, that over the last 10 years, I think she said that she'd found one publication with the words social policy and Middle East in their title, and it's an UNRISD publication. So I think we're very proud of that, but obviously it does demonstrate the importance of this issue that has been very much neglected in research and policy. And finally, but not least, of course, is Andras Ottov, professor of the Faculty of Economy and Business of the Universidad de Chile, and a member of the Provisional Consultory Board. He's a former director of the Division of Social Development at ECLAC, and obviously, in this respect, I think has been very instrumental in many of the very progressive research thinking policies in that region. So welcome. We're going to I'm going to ask a few questions to sort of allow all of the panelists briefly to put some of their main thinking and ideas and reflections from the workshop in to the audience. We'll have a couple of rounds of discussion, and then we'll open up to the floor to get your questions and come back for a final round of responses. And so I think as we've just heard, we've got a really a changing context, some real issues, some real policy choices to be made in trying to move towards both greater inclusiveness and sustainability in a development agenda. And there's shifting debates globally, regionally, nationally. And so I want really to pose the question of what we think is new, where are the changes and opportunities, and how can we move forward on this agenda. And I'm going to turn first to Michael to reflect from his more global social policy perspective on these issues.
Thank you, Sarah. I hope I'm allowed to be a bit provocative. So, but I'll try make 4 points, and they go in a logical order. I go from policy space to a conclusion on the size of it, on the social policy space, and go from there to political policy fads and traps, and from there to a conclusion why we need the MDGs so urgently in the post-2015 MDGs, and by implication why we need UNRISD. But well, that's just to be friendly in the end. But so first of all, policy space. Well, I think what's under-researched, and some of those things you may have heard in different items, but the national policy space in developing countries on social protection, on social protection policies. I don't know nothing about social policy, so I speak about social protection policy. They're determined by globalization to a large extent because it has a direct impact on fiscal policy. Fiscal policy is the affordability debate, is equals in some part to the affordability debate on social transfers. And transfers is everything in social protection, not just the new fad, which is social transfers in a way that you may hear the words. But every social security benefit is an income transfer. But basically, we have these fiscal space limitations due to globalization. Then at the same time, we have a bit of social policy space opening up through international instruments like the MDGs and the recommendation on the social protection floor. It basically were created to create national policy space for policy actors. Then you have the fourth component that actually impacts on policy space at the moment is the emulation of different models from one country to another, the North-South, the South-South learning processes, which are enormous and have an enormous impact, should not be underestimated. And then you have the whole advisory industry, the international agencies, but to a large extent the big NGOs and the donors who advise countries, who actually determine the social protection reality in your country, in many countries to a large extent. They create social assistance schemes that the government has never dreamt of before, and it comes out of donor initiatives. So all of that creates space. And what I think, if I put a line under that, and I add them all up, I think the social protection policy space is still shrinking, even though we seem to make superficial progress on what we seem to have in terms of new systems, in terms of initiatives. And I tell you why I think it is shrinking. They're fads, and I know that Sarah will probably crucify me for it. One of them is transformational social protection. The other one, and it leads to something like conditional, and the whole debate on universalism versus cash transfers. Cash transfers, whether they're conditional or non-conditional. Cash transfers. About 10 years ago, we were discussing, let me go back. 10 years ago, we were discussing about microinsurance schemes as the new recipe for social protection. It was a dead end. And basically it was a dead end because policy went back from the 21st century and the 20th century into the 19th century, or into even the 18th century when we had microinsurance schemes. In many countries, de facto small schemes that never survived. Now we have transfers, cash transfers. Cash transfers are a 20th century instrument, which is basically social assistance. It's simply social assistance in many ways. And the discussion that you may have is whether you roll this out universal because you're saving means testing cost, or you are having it means tested for some reason and conditioned for some reason or the other. But basically it's an old instrument. But what social assistance, if you look at it, somebody said yesterday rightly, social protection is made up by social insurance, by universal schemes, and by social assistance. Largely, technically, that's right. But social assistance always were an epitome of the residual welfare state. And the residual welfare state was a welfare state under pressure for policies for fiscal space. So basically, the whole policy fad on social transfers is, in a way, coming out of our self-censoring mind, and I don't exclude ourselves, our NGOs and the ILO and whatever, who all went for this piloting of socialist, basically age-old concepts, social assistance schemes. And because we couldn't roll them out, we didn't have the money that the bank and the IMF and other international organizations have, because we can't roll them out nationwide, which we should, right? Because the idea that you can pilot test social transfers is a joke. But what do you do for those who are living in the next village? And why do you justify that you're not giving benefits to a whole country or a whole society, and you pick up a few hundred lucky cases? This is unethical in the first place, but we didn't have the money for it, so we were pilot testing it. It serves the industry who's actually pilot testing it. What else would they do in a residual welfare state situation where policy space comes under pressure? And that's an implicit reaction. We've invented new words for it, saying transformational. Now they're conditioned and they're changed the people's behavior, and we're investing in people. All of that in the bottom line, when it comes to transfers, when you come to the people who are actually deciding who's poor and who's not, who's getting benefits, it gets back to the old social assistance scheme, paternalistic in many ways, and leaving no space or limiting the personal freedom to do what you do and whatever. So basically, it's an old instrument going, I know I have to finish. But in order to correct, it all comes from a limitation of policy space for social protection policy on a national level, because the systems are the government's under pressure. So if we don't have good post-2015 development goals, we have no item that corrects the policy space limiting factor that comes from financial globalization. So we need them desperately to actually create the space for national governments to justify the extension, or at least to maintain the fiscal space for social protection policies. And for the same reason, we need UNRISD, right? Because somebody has to say that. And Sarah, if all of us who are seriously fighting in that direction are facing budget problems, it's an indicator of success. If we had no budget problems, we were preaching mainstream economics, and we weren't actually looking after people. So basically, I always say to our people when they complain that there's no money, I say, take it as an indicator of success. People think, so you are successful, you're having impact, and if you, in order to limit your impact, we limit your budget.
Thank you. Well, I'm not sure if I'm reassured by the fact that our lack of money is an indicator of success, but I certainly appreciate, and I'm not going to crucify, I mean, I think that what you're saying is actually very much in line with our argument, and the issue of transformation, it's on the agenda now with the SDG discussion. It's one of those words that's coming up all the time in the debates. We used it a long time ago, several years ago, in reference to social policy. And it was then picked up later and attached to social protection. Now, for us, there's no such thing as sort of transformative social protection, really. We can say exactly what that means. For us, social protection has had a transformative and developmental role in many parts of the world, and we can see that going back to Nordic countries, East Asian countries, when it's been linked to economic policies and other policies. It's been transformative when the functions of protection, which is one of them, are also well linked and integrated with other functions, including productive functions. And that's one of the issues about the post-2015 agenda, that the MDGs have been criticized because they didn't make that link with the productive economy. So they've had the protection, the production, the reproduction, thinking about the care economy and how labor is reproduced on a daily basis, families, households, societies reproduced on a generational basis, care work, and also distributional functions. And I think Jimmy would add very strongly national cohesion and state-building, nation-building functions. So that's what we mean by transformative social policy, and I think that's the direction we'd like to go. But I want to turn now to Rana, and sort of in laying out these issues, one of the big changes I think that's happened in the last decade that we've all been very aware of is what happened obviously in the Middle East and North Africa, and the demands that came out of that region. And many of them also relate to these social and economic policies. And maybe reflecting from that part of the region, what do you think the main concerns, issues, policy concerns we should be looking at going forward?
Okay, thank you, Sarah. Hello, everybody. Thank you for inviting me. I think with the Middle East and North Africa region, the first thing to say is that they have had welfare systems and social policies in place for a very long time, but academic research and policy debates haven't really paid attention to these, and perhaps there are other more pressing geopolitical issues, which obviously we all know of, have sort of taken precedence. So in a sense, I think progress, I would say, just in response to Sarah, perhaps has been slow, or it's been a little bit of more of the same after the Arab uprisings, in the sense that the governance systems and the political systems in place have generally, haven't changed really, even though there may have been regime change in, some countries like Egypt, that the welfare systems that these countries have followed have been quite residual. whereby, and very much focused on an old model of economic development, which is the growth first and trickle down approach, and the social hasn't really been of concern to governments. The social arena is something that's left to the family and to sort of community-based organizations, whether they are of religious or tribal character. So in a sense, the Middle East and North Africa region has been following a sort of a parallel world, if you like, of employment-based social security with a lot of focus on health insurance, whereby public sector workers, perhaps for very obvious reasons, have had the best deal, and very often, I'm sorry to say, the elites, have used public hospitals in the best ways and get the best form of public healthcare provision, and that perhaps this is not accessible to the rest of the population. And parallel to that, there has been a system of safety nets and social assistance, and this is deep, I think, in the mentality of most Middle East and North African countries. And I should probably clarify, by this region, Iran, Turkey, and Israel are, for various reasons, I probably, when I refer to the MENA region, I may probably primarily be referring to the Arab countries. I think the other three countries may be different for various reasons. So I think in most Arab countries, certainly, there has been this mentality of two parallel systems of employment-based social insurance. So basically, you will access health services, you will access, pension systems, and based on the type of employment you have, very much in partnership with private insurance companies. After the Arab Spring, if you want to call it an Arab Spring, there was a kind of an upsurge in, more social assistance. So there were more cash handouts, or a sort of an upsurge in subsidies, so food or fuel subsidies in countries like Syria and Jordan. Iran did this as well, Saudi Arabia, so the Gulf states. So there was more of this emergency relief, social assistance mentality to try and dampen down the sense of, the high cost of living, the difficulties of just basic survival in this region. Some countries, particularly the Gulf states that have the fiscal capacity, are sort of pushing for universal health coverage. So they call it universal health coverage, but it's actually, it's contribution-based, employment-based health insurance, but the idea is that it is now compulsory. Okay, so all employers and all employees, have to make this contribution. But again, not really addressing underlying structural inequalities. You may not know that, 2/3 of populations in the MENA region have no formal social security coverage. There is around 70% of informality in the labor market. So who is going to access this compulsory health insurance? Tunisia has done well in ratifying a new constitution now. So, something perhaps has happened there, but we have to see what happens afterwards. So I think the kind of radical, transformational social thinking that is badly needed, and that was very obviously the cause of the protests that began in 2011. And people should remember that there were lots of protests before this, going back to the 50s and 60s, which perhaps the media hasn't talked about enough. So the kind of radical thinking, perhaps, has yet to be seen. But I do think that maybe now is the time. I think perhaps with research, with more mobilization among the citizens, and who knows. So roughly that's where we are.
Great, thank you. I think that gives some clear pointers to what some of the issues and changes in the region. I think one of the things maybe for me and for many of us that came out of observing, without being an expert on those regions and the changes, was youth unemployment and the issue. And I think that really helped put it on the global policy agenda again. It might be interesting to reflect a bit more on that, and particularly then when you're talking about high levels of informality, what this means really for access and expanding the kind of social policies and protections that both in that region but also elsewhere. Let me turn now to Jimmy, who's been very closely involved, I think, with a lot of the UNRISD work, but really has a very deep knowledge and engagement on these sort of issues of how social policy can be part of a development process, and hearing from the African context where you think the real challenge is and where we should be going now, and what the role of the international community here can be in that context.
Well, thank you, Sarah. But, let me perhaps start with the issue you were raising about going beyond the question of social protection and understanding social protection as the protection as one of the many tasks of social policy. And in you mentioned the production, the reproduction, the protection, the question of nation building. But part of and in that particular context, the way in which it's linked to development strategies for transformational purposes. And this is actually not something perhaps unique to the African context. I'm thinking of the early period, immediately after independence for many countries. If you look at Germany, if you look at Sweden, I mean, there's two examples where what you may call the multitasking of social policy. So you won't look at the Swedish system and only look at it purely in terms of what you may call income stabilization. Your income support, you have to look at it in terms of investment in education. You have to look at the investment in healthcare. But the whole idea of citizenship right or residence right in terms of accessing this thing. But the education thing is linked to the question of innovation in the economic sphere, because it's the virtuous link that you develop between these, and the way in which your growth strategy works then means that you have a fiscally sustainable social policy instrument. The problem that we have at the moment is the disconnection, and regardless of much of what I believe may be considered innovations at the international level, social policy continues to be extremely quite residual. Or even social protection. It tends to focus on, even if you look at social protection instrument, you mentioned earlier on about the question of cash transfers, for instance, it tends to look at vulnerability after the effect rather than what do you call it, ex ante. In other words, where you prevent vulnerability rather than wait until it happens and you respond to it. And here again, Sweden particularly becomes quite interesting, because I think one of the most outstanding scholars in this area will be Alvan and Gunnar Milda. The whole idea of prophylactic social policy. Now, the link with what do you call it, economic development thinking becomes quite important, because you cannot pursue an economic policy that is based on selfishness, the gratification of the self and individualism, and then want to pursue social policy that is supposed to be about solidarity. And social policy is not like walking into a supermarket and you can buy a piece of soap here, a piece of something. There has to be some measure of coherence within this. That's why I'm not particularly quite optimistic actually about the environment we're in. And the need for us to go back to a transformative social policy point of view rather than a social protection point of view, whether transformative or not transformative. The second part of that is quite frankly, the notion of desirable well-being of human beings that we need to look at. Whether you're looking at Germany, you're looking at Sweden, or you're looking at Tanzania, Western Nigeria, in which I was born, and things like that, there was a high aspiration level as to what it means to be a citizen in terms of your well-being. And let me give as an example, without meaning to cause any offense, because I know I'm within the UN system here. And many of us will probably say hooray if we say MDG1, right? It's about, what do you call it, reducing poverty, hunger, and things like that. But what exactly are we talking about? It's $1.25 per day. Now, if you translate that in the, what you can buy in the South African context in which I live, it will be a loaf of bread, that's the brown bread, which is the cheapest, and a bottle of water. That will give you about 14 rand. And you will have met MDG1. Of course, you will have dealt with hunger, because you can break your loaf of bread into 3 parts and drink your water in small parts and have lunch, breakfast, lunch, and dinner. But remember, the person is naked. The person is homeless. The person has no shoes on and this and that. And I think it is important for us to go back to what the UN used to stand for in the 60s in terms of a higher level of aspiration. And what then becomes problematic in the kind of, social protection brigade that you were talking about, that's marching all over Africa, is I've run into colleagues who say, well, we're piloting this thing, and say, well, how much is it per person per day? Well, the one in Kenya is 83 cents. Remember, destitution is $1.25. Now, you really have to have a low estimation of people to give them 83 cents per day and then say, hooray, we're making progress. In the meantime, we're told out of that they're able to buy something for their children to go to school. When I went to school, it was universal primary school. I had access to education, secondary school, access to education, university. I keep saying this thing, if it depended on the resources of my parents, I won't be here today. But there is a link between that in terms of healthcare, education, and funding and access, and the level of innovation you can expect in a society, the level in terms of economy and this and that. So if you take my native country, for instance, again, I probably wouldn't mention, I understand it's a bit of a problem to mention particular countries, because it can get protest. If you take my, poverty among households headed by people with secondary education rose from 7.6% in 1980 to 44.25% in 2010. It used to be said for my generation, if you work hard in school and you study and you increase your education, you will work your way out of poverty. You deal with education and intergenerational poverty. And what we've had is, in fact, while we are concentrating on the so-called most vulnerable, who are actually living in absolute destitution, the middle class itself is being obliterated. And there's none of the countries that we can hold up as examples. We didn't try to hold the whole of society together. And in many of our countries, in sub-Saharan Africa, you can plot the explosion of society, the collapse of state, to in fact the particular types of policy instruments that were rolled out, which say it's not the business of the collective to look after the individual. Okay? The point you were making earlier on about how there's so much growth. I mean, my native country's, economy simply jumped now to be the highest in Africa. But there has never been at a time when we have a higher percentage of population that is poor, living in destitution. And the result you get is the kind of revolt and uprising and so on and so forth. In other words, and let me end this way, there is no way we can look at social policy only in partial way in which it suits international agency to just say, yeah, we are responding to the poor. And there is no way you can separate your strategy there with your strategy in your economic policy. We cannot pursue social policy that is not sustainable. So the financing of it becomes important. But you can only finance it when you don't think in static equilibrium terms, but you think about the dynamic way in which an economy grows. It's about investment in people. And in a context like sub-Saharan Africa, where the last something that I look at, 78% of the total population lives below $2.50. What are you targeting?
Thank you. I think that's put a huge number of issues and really big challenges for us. I'm sure you'll have a lot of questions to come back to. I won't try and highlight some, because I think now I'd like to hear, in a sense, to the region that's been held up for many of us as a success story. Inequality is coming down. We've got all these great cash transfer programs that we've heard about. But I think it's also a region where maybe looking ahead, we see some other kinds of challenges and maybe there are lessons also from these experiences for other parts of the world. So let me turn to Andres and ask you to reflect on the Latin American region and where we go from here.
Okay, thank you. Thank you very much, Sarah. Let me first start saying that it's very difficult to talk about Latin America because it's very heterogeneous. You have countries like El Salvador, Nicaragua, Bolivia, where they're still eligible for ODA, and then Chile, Argentina, Brazil, who are at other levels. But also, if you go into the countries, you see quite difference. You can have better standards than in Geneva in some countries, and worse standards perhaps than some sub-Saharan countries. So that's one main point. It's difficult to talk about Latin America. Now, I was struck coming here, and I mentioned it in the seminar, that we are known for the wrong reasons. We're known for these conditional cash transfers, which we call co-responsible cash transfer, because conditional is too harsh. Co-responsible cash transfers, but that is an allocation of only less than 1 point of GDP, whereas there is a large other share of GDP which we spend on social policies, and very badly. So that's another point that you should know. Second, we are mentioned as a country or as a region that's reducing inequality, but still our standard of inequality is quite above the standards of the other regions. So that makes a very interesting point. And although we are overcoming absolute poverty, if we have high inequality, we will have a problem of relative poverty, and that's showing very strongly. So that's some things that should be kept in mind. Then you open the TV, I'll do the exercise. We don't exist, at least in the open TV in the hotel. There are news about all the regions. Latin America doesn't exist. You can't find our news anywhere. So either we're a no-problem region or we don't exist. And coming from there, we do exist and we do have a lot of problems. Let me just try to summarize what the changing context in which we have those problems. First, we have what we might be called the growing pains in human life. Usually the kids have some growing pains, and we have growing pains as becoming a middle-income region. What does that mean? That we have to self-finance our social policies. And in self-financing our social policies, we sort of recognize suddenly we have very scarce resources at the public sector level. So either we have fiscal and social covenants to increase our tax burden and tax base to be able to finance new policy, or we can not do it. And if you open Chilean TV news now, the large discussion in Chile with the new government of Bachelet is having a tax reform in order to get the resources to be able to solve the educational problem. Why do we have these educational problems? After, as Sarah pointed out, we look as a very successful region. Because we have, since the government had had no money, we have had to move into either employment-based or contributive models, either in health, in pension or education or whatever. We have to pay for our things. And if you have a very unequal society and you go in a liberal way, as we were pushed by IFIS institutions, you move into a market economy in which the rich can pay for very good services and the poor cannot pay for the others. So there is a rich and poor differentiation, but also middle class differentiations. The middle class are able to get indebted in order to satisfy the goals. But by the time they satisfy the goals, they cannot do much. There's a high unemployment of the middle classes, high unemployment of the youth, and we say sometimes that education in Latin America is being depreciated in the sense that by the time the poor get to the secondary level is worse for them. So we're sort of living a discussion in which we need to recover the welfare state from neoliberal reforms that were made in the 90s. And in doing that, we foresee, what we foresee as our main policy objective is that we need to construct what was in the 2 days delivery very strongly came out, these crop subsidies between the rich to the poor and between those who are healthy to the sick, and between the young to the old, or whatever. But we will need to construct a lot of solidarity funds in order to solve our individual problems. I would say that sort of summarizes the changing on context and the way we foresee things are doing. Financing social protection or social policy in the future in Latin America will need a lot of solidarity components, and we need to learn how to construct those funds. By the way, informality in Latin America is 45 to 50%, very close to what it's a minute.
And of course, informality or casualization or precarious employment is increasing even in countries both in the north, but also the maybe more countries that otherwise in Asia, for example, doing very well economically. So that's clearly one issue. I think there are a number of issues that have been put on the table here. These issues around how you construct a sort of more solidaristic form of welfare or policy. Issues around the links with employment, issues around innovation, education, all the things that you know, a number of things that perhaps need more attention, but maybe there are also other issues. And I'd like to just come back to all the panel very briefly to sort of bring in, you know, either to respond to something that's come up that you think, yeah, that's really important, we need to move forward on that, or something, what's missing, where we need to move forward. You know, what are the issues that we really need strategically to focus on in thinking about a post-2015 and moving forward more concretely to achieve the kind of progress we're all looking for. We've got a very complex picture, if you like, and we know that it's not easy, and we know that, you know, a set of targets and goals is not going to move us forward. But then how do we move forward? Where are the spaces and opportunities? We've heard some of them. I'm just going to ask everybody to respond a little bit more, add a couple of comments, and then I'm going to open out to the floor.
I think it's probably what Anders said that triggered this in my mind. I mean, we kept the hearing, what you hear about social, if you try to reform or create new social protection systems, is always the affordability argument. That's the first deadbeat argument that you have there. Say, we can't afford it, we have to grow first. And there's a chicken and egg problem there. Because basically, and I agree with what Jimmy said, if you don't invest in your people, if you don't nourish them properly, if you don't educate them well, how can you create a society that can grow? And if you create a block towards the supply of productive labor. So basically you have to invest in there. So I think the answer to the problem is that the best social protection policy strategy that you have in a country is get your fiscal policy right and basically get your tax system right. And it isn't very sexy, but if you don't do that, there's no way you can do anything else. And it's very painful, right? And the second thing is, and the second major thing that always bothered me, in the ILO, they tend to do social budgets now for 25 years. So they know that Chile's social budget, I don't know exactly, but it's somewhere between 15 and 20% of GDP. What they spend on Chile Solidario, which is the really basic social protection system, is less than 1% of the GDP. So where the hell is the rest wasted, right? There's huge transfers going on, and this is group solidarity. It's not national solidarity. So there's groups of solidarity, the privileged people in the formal sector that look after themselves. And that's the core of the Bismarckian social insurance system. It was proposed by the ILO for decades. I think it was a dead end. It didn't contribute to greater informalization. We have stagnating formalization in many countries. We have stagnating coverage of these systems. I think there's about time that we do away with it and go back to properly working tax regimes and properly working national solidarity systems, and do that as a first stage. And then you can think about whether you want to have group solidarity on top of that. But going the other way has simply been proved to be wrong, and somebody needs to get up and say that.
Right. Just to add on to that, so thank you, Mark. Just a couple of things. I think the growth first issue, yes, we understand that, but if you look at India, typically, for example. India's had phenomenal growth, but in a very specific sector within the technology sector, which is very much concentrated, in a sense, around elite political and business elites. And you know, India still has the highest level of food malnutrition in the world, and there are two parallel worlds in India, for example. You know, there are numerous countries around the world. So I think that the growth first philosophy, I think that we need to think about the quality of growth and how it happens, and perhaps that there needs to be some consideration in, you know, particular areas of growth, or how it is friendly in terms of labor, particular labor markets. So I think that just growth, yes, but what type of growth are we having? I know I'm not an economist, but I think that there's sufficient evidence that will point in that direction. Secondly, yes, I do agree. I think there are some immediate housekeeping issues, if you like, certainly within the MENA countries, in terms of, you know, existing social security systems suffer from wastage, from duplication, from administrative sort of bad management. So I think there are certainly some immediate housekeeping reforms and administrative reforms that can happen, that possibly, you know, can lead the way to much bigger conversations about solidarity. But I think that we are living in a different time now, where the global economy is very important, and we cannot talk about countries and regions in isolation. And what happens at the, you know, in the global economic market has direct implications on countries in the north and in the south. And I think that very clearly, even more so, we have a sense of power imbalances now. And I don't even, for me, social solidarity is not enough. You know, yes, I couldn't expect a poor person to have solidarity with a rich person in the same way. And I'm sorry to speak in such black and white terms, but I think that there is a question of social responsibility as well, which is very clearly linked to issues of unequal power around the world, which is also linked to the, you know, to global terms of trade, and the fact that countries are not isolated, and what happened in America very clearly had an influence on what happened in the UK and elsewhere. And there's no longer a north and south divide. Unemployment among youth is the same thing. You know, you have similar problems across regions. So in a sense, there are real power dynamics as well that I think need to be addressed, and growth is where we could start, possibly. So thinking differently about growth as well.
No, I think you probably misunderstood Michael. He wasn't talking about growth first. Indeed, far from it. But let me come to actually what has happened, my sense, in terms of over the last 20, 30 years. That actually the fiscal space for most states have been constrained, especially in sub-Saharan Africa. I'm South African by domicile. I pay less tax today than 10 years ago. Okay? 1994 something will have been 50%. Okay? My marginal tax now is 40%. All right? And the same situation, if you look at the, what do you call it, the inequalities in the healthcare sector, as an example. People like myself, who use mainly the private, you know, healthcare sector, because we have health insurance, are only 8 million out of a population of 51 million. And the average spending is 11,300 rand per person in that sector. The public sector, the average spending is 1,900. And that supports about 35 million people. If you add people who shop to between the two sides, it's another 8 million, you know, I mean, the figure, you know, like that. But that level of inequity is actually extremely inefficient. You have an extremely fragmented systems. We know around the world, and again, if you look at the types of healthcare systems and you look at healthcare outcomes, that in fact single-payer national public healthcare systems are far more efficient and they cost less. Now, happily, the ray of hope that I find in the South African context is the national health insurance policy that is being rolled out. And it's come again, you know, enormous resistance. It's incredible. I mean, brokers alone, if the last statistic a few years ago, took 1 billion brokers, people who just, you know, into brokerage in healthcare, okay, to 1 billion per annum in terms of the health expenditure, and so on and so forth. I mean, and yet we're dealing with situations. These are life events that you probably didn't plan for, and can be so dramatic in terms of the impact on people that the concept of being middle class can disappear in a day, because there's cancer, there's this and that, the issue is not the availability of resources within a country. You cannot explain 11,300 for people like me, okay? And when the other average, the greater part of the country has to manage with 1,900, and with 35, more than that, now almost 40 million people actually, dealing with the public healthcare system. Of course, the public healthcare system is going to be overloaded. And then we're going to turn around and say, we can't use the public healthcare system because, it's such a crappy thing. So the issue of even the way in which we rationally manage something, and you can look at me, people talk about South Africa as the miracle something and this and that, but the level of discontent today and revolt and this and that, this is not rocket science. Maybe rocket science is not that complicated, but it's not rocket science. And countries that do well in this area, the issue of solidarity is fundamental to this. And the solidarity here is this. Let me give us an example. For instance, I will be better off in terms of my disposable income if my tax rate goes up to 50%, but I have single payer public healthcare system, public education system, and public transport that looks like that of Geneva. You have no choice. Okay? Do you understand what I'm saying? So even for the middle class itself, it's an unreasonable proposition. All right? Because you can run into a situation where just one, 60 years can eat so much into your savings, in your health insurance, that by August, it happened to me 3 years ago. I was doing preventive something, healthcare, a test. And I was informed by my healthcare insurance as at end of September that I'd run out of my savings. So anything that I had to do for the rest of the year, it has to be out of pocket. So, I mean, even at a micro level, this is just a set of irrational things that have been deified by people, by the top 1%, that actually don't need the money they have. Thank you.
To bring to the floor 3 lessons from Latin America based on the discussion we've had. First, it's true, we spend only less than 1% on social protection flow, if we can call them that way. They're not social protection, they're cash transfer programs. And there's 14 points that, at least in Chile, that somebody should know where they're going. And so accountability is very important. Accountability of what are you spending and where you're spending and what are the outcomes of it. It's very important, especially if you're going to demand more resources for increasing solidarity or whatever you need. Second, if the need comes that you need more contribution, you should not privatize your contributions. Once you privatize your contributions, you reproduce inequality. Either in individual accounts, as it's happened in the pension system in Latin America, also private social insurance, where they will scheme the population, and the rich and the healthy will get good health care, and the rest will get very bad health care. So, and the third one is that usually, if you want to move through universality through taxation, general taxation, we must recognize that our regions, especially Latin America, we have a very large share of indirect taxes, and that's very regressive because usually based on consumption. So all those issues are in the middle of the discussions of once you want to get additional resources, do a tax reform, all these issues come into the floor. So those are 3 lessons I can bring from Latin America on the discussion we had this.
Thank you. I'm not going to try and sort of make any synthesis at this point. I think we've had a lot on the table, both across regions, different regions of the world, but also on issues from sort of quite normative and idealistic and the, values behind social welfare down to quite technical, housekeeping and taxation and what kinds of financing work differently. And there's a lot out here for you all to engage with. I'm sure there'll be a lot of people who want to make comments and questions. Please try and keep your comments, questions quite brief so that we can get quite a lot out here. I'll take a round and then come back to the panelists to respond in as they see fit. So it's open to the floor, and I can see, okay, yes, Gabrielle.
Okay. I heard a lot about government, UN system, civil society, and not too much about enterprises. So I'm from the ILO Cooperatives unit, and we have been looking recently at cooperatives as a possible model for a form of social enterprise that is inherently economically, socially, and environmentally sustainable by its definition. And we've just come out with, actually, can you hold that up? With a publication that starts to look at the actual contributions of cooperatives to the likely sustainable development goals, and copies are available on the back table. But we feel that a lot more work needs to be done. This is just really a first step. So I know that UNRISD has done some work on the cooperative model in the past, and I wonder whether research on social enterprise models such as cooperatives came up in your discussions in the last 2 days, and whether you plan to work in this area. And my second question is about the potential of cooperatives in social protection, which has been a focus of of the presentations today. Of course, in the long term, the goal is universality and reform of fiscal and tax policy, but we all know that that's not necessarily going to happen tomorrow or even within a few years. So in the meantime, don't we have to look for other models and means at the local and national level that could meet social protection needs? And are cooperatives one of these options that could? Thank you.
I have a question. Adesina first. When you say investment in people, and I totally agree with that, do you have any example of a country investing in people? And who does it well, basically, and how does it, is it possible for it to be repeated elsewhere? And another question is about, it actually raised quite an eyebrow because I heard that in some countries in Latin America, middle classes are being, they can be indebted, actually. So how does it fit in social policies, what I will call positive social policies? Because for me, indebtedness is not really something positive for anyone, actually. And the third one is a question about global market and solidarity. And I think it's Mrs. Rana who raised it in answering another topic. So for me, I was wondering if raising the level of solidarity above the individual level is for you possible, because for me it's possible, even between countries, companies, organizations, and how would it be possible actually to apply that? Okay, thank you.
We've initiated a program which is called the Alphabet, and what it is a study in depth of the language being used. Because I find it very worrisome if you take the issue of universal health coverage, which is intimately linked with universal social protection floor, you see that the words being used don't have the same meaning, different. And when you analyze research documents from the WHO, the World Bank, Davos, all universal health coverage, you see that the approach in many of those documents is from an ultra-liberal economics approach. So we're not talking about something universal, we're talking about something that would cover everybody. We're not talking about in-depth coverage, we're talking about minimum package of health. And we're talking about private insurance giving people the cash transfer, in fact, to buy a minimal package. So this is really the opposite of what Jim in particular talked about. In other words, it's a regressing, it's a backward, very dangerous trend. And I think that we have to be careful in the UN because sometimes we think we're using the same words, but we're not. And the question of the economics in the background of the documents being issued and the policies, as in the MDG. I remember Jomo Sundaram calling for examination of the MDGs in ECOSOC right here last July, you know, because if we pretend that we're going for the MDGs, but we keep the ultra-liberal approach, we are actually going to dismantle countries. So I would like to have your reflection on that, and I very much like Jimmy's point. Myself, I'm French and American, and on the American side, a very wealthy family, they used to pay 70% in taxes in the post-war period, and now they pay 10%. And on the French side, we see the dismantling of social protection system, and it's very worrisome.
I wanted to maybe ask Rana to reflect more on the cultural side of the social, so especially in the MENA region. And the example that I'm thinking about is the Muslim Brotherhood that came to the attention of the big public because they came into power in Egypt, but actually it is a form of social policy, if we want to intend it like that, that has taken many forms in different Arab countries. And in the discussions that I've heard in these days, there has been a lot of social and thinking about the paradigm or the ideas that we should put together. But I think we should think more about the cultural aspect. So I don't think that, for example, a policy could be successful in the MENA region, but as well as in Africa. Professor Adesina was referring to, for example, policies with transfers specific to one person, and then if you don't share with your neighbor, you're not well seen and you're not accepted in your society anymore. So I think we should think also about this kind of aspects.
I was wondering the extent to which the panel would agree about the intrinsic tensions between MDGs and the need to construct national tax-based reciprocal welfare regime or welfare states, and how that, in their eyes, links into the possible tensions between the human rights approach to social protection and the citizenship, social citizenship rights approach. And with one, whether the I see human rights as within a liberal citizenship model with focus on marginalized groups, and that this finds some tensions with the need to build social solidarity along a discourse of equality. And I think that maybe, while it's very, there are obviously advantages to both approaches, maybe acknowledging the tensions between the two could move the agenda along in some way.
Yes, I mean, to Aisha's questions in terms of which countries are investing in people, you know, actually, it's a question that one can only ask after the horrendous, you know, what do you call it, damage to public policy environment in Africa over the last 30 years. It's not, you know, if you were to take a whole range of countries, for instance, I mean, I always say to people that if there's something that post-colonial African leaders got, they got education. If there's one thing they got education, they got it right. But all that was dismantled in the what do you call it, 90s. I mean, all sort of, you know, very petty-minded pseudo-economic argument about, you know, what do you call it, private returns on public spending. I mean, I don't know of anybody who was trained with public resources to become a medical doctor who only went back to his parents and the homestead to practice medicine. Okay? They practice medicine for everybody. Okay? You don't train engineers and they only go to their villages to become engineers, even then, you know. And there are a number of African countries that you can use just as illustrations here. Mauritius remains one. I mean, there are we're involved in a project in DRC some years back, and this young man said in a symposium we had in University of, Kinshasa, oh, but there's no free lunch. You know, so I then asked in the room how many people realize they've been breathing in the last 1 hour, and how much did they pay for the air? Of course, there's no free education, there's no free healthcare. Somebody is paying for it. That's why you have to pay attention to that, to funding side. But you've taken an example of Western Nigeria, where I had the privilege of having been born, you know. And in the 50s, where a group of people who took over government came up with the position that it's a right of every child to have education. And every citizen shall have a right to healthcare. It meant that as an undergraduate, when I had an appendectomy situation, for instance, it didn't depend on the resources of my parents that I will get into the hospital and I will be operated successfully, and my parents will only know the following day when I was in the recovery room. 10 years later, in the same hospital, but not 10 years, about 15 years later, in the same hospital, in the same university, I was a lecturer now, and we lost one of my graduate students because there was nobody to pay the co-payment, you know, the one that you have to run around to pay in the hospital and this and that. You know, when doctors kill their patients, you see them. When development experts kill their patients, they died in thousands, but in their little homes. The issue about investment, you can go to Mauritius as a classical example. Much of what you saw in terms of African intellectuals that actually made it in the world and this and that, look at the background, the context in which they were trained. They were trained in a period when there was an expansive understanding of the collective responsibility. It's not state. The state just becomes an organizing framework because the scales of many of these things have gone beyond village level and that of family level. That's one dimension. And I think in many ways, the key challenge is the difficult challenge. It's about you know, what do you call it, reversing and changing the way the state thinks, where a state does not see its citizens as a nuisance. No, yeah. I mean, if you're an oil-producing country with 2/3 of your oil, something coming from offshore, and 90% of your income is coming from that, why do you need your citizens? Okay? Yet, so even if you assume that there is fiscal space, if there's fiscal space because of this revenue, if there is no transformation in the way in which people who are in position of power think about citizens as resources rather than nuisance, we're not going to change some of these things. But that's also because, you know, neoliberalism is dead, long live neoliberalism, okay? Is that even states that want to do this kind of things, Ethiopia is an example, and my university is responsible for training the PhD for, you know, Ethiopians in PhD in terms of staffing the universities that they elected. We had donors harassing the Ethiopian government. Why would you want to spend money on, it's a waste of money to be spending money to train people for university. I mean, we're in the 24th century, and we're talking about basic education. I mean, who will assume that there's something called basic education in 21st century when you need so much skill to actually get basic elements of your economy running? And it's the same thing. I mean, the issue, for instance, about and that's why I raised the problem we have now about the diminution of our vision of human well-being. So we have this whole international charter, and we're talking about basic health. Now, I don't know what basic health is. If you get knocked down by a vehicle, all right, and you get up in hospital, what is basic health when you need surgery? If you have cancer, breast cancer, for instance, what is basic health? I mean, okay, malaria, yes, but actually, if you structure your healthcare system very well, you deal with many of those things at much cheaper level, at primary, you know, healthcare systems level. So, and I think that is important, and it's also about the capacity to imagine. And I will end here that some of the more innovative cases that we have around the world were about visionary agenda setting. And it's about our ability to go back to visionary agenda setting. Well, it may look like the Beatles said, you know, you may think I'm a dreamer, but I'm not the only one. And I'm hoping someday you'll join us. Because it's the dream we dream on our 2 feet in broad daylight that becomes based on the reality of tomorrow?
I don't want to go back to the cooperative question because I would think comes out of a general principle. I think there's only one excuse why countries can break national solidarities into group solidarity, and that is in failing states. Because you can't organize national solidarity if the state is failing. So until such thing, you probably have to have some form of group solidarity, and nothing's wrong with it, whether it's religious or cooperative or whatever. But it's not an answer to a sort of overall welfare concept and development concept for a country. It just has proved in so many instances, in so many pathways to fail. So I think to repeat that clearly, there's only one excuse to break national solidarity into group solidarity. That answers the cooperative question, I think, nicely. And then again, what I think there's only one excuse is because what you tell me, Rana, which is wrong. I never said growth first. I actually believe in something else, which is that basically there's nobody to share, as long as you have something to share, right? So if whatever the level of GDP, you can redistribute something, and you can redistribute a level of social, in form of a level of social protection. And you can show that easily in statistics and development strategies, in development trajectories of specific countries, that they started very early to redistribute at a very low level of GDP. So there's no way that you need growth in any case. This whole story about inclusive growth is another fad, is another red herring, right? So for social protection policies, it's not that growth is a prerequisite. It's just not true. It's a certain level of GDP to survive. That's probably the bottom line, but it's not growth as such. So that's something that I wanted to hammer home. I don't see the tension between the Universal Declaration of Human Rights and universal social protection systems. I don't see that. But what I do say is that what the social protection floor does, it arrives at a consensual midway point. And that is, it went from universalism and universal protection. It went from universal coverage to universal protection. That means everybody has access to a system that provides him with income security should he need it, or she, right? And everybody has access to essential health services. And the trick, Jimmy, was to stop the talk about basic and put essential in. And every healthcare that's not essential shouldn't be produced. So basically, so I'll leave it
here. Can I let them speak first, and then we'll come back to you. Sorry, I'm supposed not to hand this.
So thank you. I have a couple of questions, but it seems I have to reply back to Michael now, just to say that I'll get to that in a minute, but I think I should probably respond first to our questions, just to do things properly. So thank you. I mean, the question of, I think the lady's gone, but question of cooperatives have been promoted in some MENA countries and the Gulf countries, but I think equally there is a question of corporate social responsibility, which is perhaps an issue we didn't touch upon, but is a reality as well, and perhaps may link up to cooperatives, and that's something that's an aspect of social policy, if you like, in the developing world. There was a question about global solidarity. Global social policy is obviously an area as well that increasingly has gained attention precisely because of the interlinks, because of the global economy and countries dependent on each other. So that is certainly an area where perhaps there is more discussion about ways in which global solidarity perhaps is an issue, and there are forums that will debate the desirability and the feasibility of global social policies. And I think to a certain, I'm not sure, to a certain extent, lest I make another error, perhaps with the ILO, I think there are some areas where perhaps there is a sense in which there should be shared solidarity for global social problems. So I think that's still an emerging area, and it's quite complicated. And there are questions about how desirable it is to have some kind of standardized formula for global social policies. Not quite my area, but it's there. In terms of the question on culture and religion, I think we could have a 2-day conference on religion and social policy, which would not be only specifically on the MENA region, but for the world in general. Specifically in relation to your question, Religious groups have had a long tradition, and Islamic groups have had a very long tradition in social welfare provision for a variety of reasons in the MENA region. I think more recently this has become embroiled with political projects. What I would say very briefly is that it is important and it is possible to distinguish between the civic and the social solidarity elements of religious social welfare activism from the political dimensions, and that's an important area that we shouldn't miss and that could potentially contribute, and they can't be written off, because the religious dimension of life still has moral sway and moral authority in the Middle East and North Africa region, as it does elsewhere, as it does in other regions around the world. So it is important, and we shouldn't forget about it. And lastly, I think the question on growth was, I was just responding to the fact that certainly within the MENA region, it is still an old model of thinking in terms of growth without necessarily thinking about redistribution or other ways in which there are equitable aspects to growth. So I was responding to that to be quite specific, but we can take that conversation elsewhere. Thank you.
Well, the issue of indebtedness of the middle classes in Latin America is widespread, but it is more serious in the case of Chile, where everything has been privatized. Let me just give you an example. I joined the public university after I retired, and I got frustrated because the students are seen as clients. Breaks are seen as coffee breaks, and professors have to rent the classrooms to teach. And there's sort of an internal market to see profit market. I'm exaggerating. Public university, the University of Chile, where I used to work. I'm exaggerating a little bit, but that's sort of the vision that's being bad. But what happens is students, not those coming from very good universities, but those coming from the private university, by the time they end and get the degrees, they don't get jobs. So they are indebted, but with no jobs. So they say, I'm not graduated, I'm indebted by the university. It's a very strong problem, and that's why those who have been able to see news about Latin America can see a lot of students walking in the streets, and most of the educational agenda is being set in the streets, not in the governments or in the parliament, setting in the streets, and it's a very big issue. About global solidarity, let me say that while working at the UN system, which I did during all my professional work, I was involved a lot with the handling ODA resources. And what you see is that those countries who are solidarity and provide the funding are very much concerned about what's happening in the country, but because there is a lot of corruption in this country. So it's talking about solidarity, you need to be very transparent in where does the money come from, what is being used for, and accountability should be again coming in, very strongly. Otherwise, it won't work. In respect to the very important issue that when we talk about coverage, we end up providing a minimum package is very true. Very true in the health sector. We're talking about a minimum floor in social protection. It's mainly because we have to sort of handle a normative horizon of human rights, but with very strong restrictions in terms of budget constraints and inequality. And the only way to come out through having everybody access is sort of rationalizing in some way, either through a minimum package or long lines, which is the other way in the market works. But what you see in Latin America at this moment, for instance, is that what the politicians are trying to do is to merge the whole segments where policymaking is taking place, social policymaking. The private sector, the public sector, and the social security sector. And instead of organizing segmentally, that each one has his finding, his provision, and his regulation, they're trying to cross-site, to organize it by functions. Look, we will fund social policy this way, we will regulate it this way, and we will provide it this way, trying to cross around all it. It's very hard, because those who are already in the private sector are handling and can finance very good services, don't want to mess with the other one, but the others do want to mess with the others. So thank you.
Okay, I have two very brief comments. So I think Jimmy and Michael, 1 minute.
No, 1 minute. I mean, I think it's important that we actually don't get into this debate of whether it's growth first or protection first. That's the debate that came out of Washington. You know, it's serious countries that have had to deal with these things have always had to deal with how you finance your social policy and how you know your social policy contributes to the growth of your economy. And it is not true. I mean, the evidence is overwhelming historically that, in fact, the countries that are very progressive started very early. It's not a function of your level of GDP. It's a function of your capacity to imagine a world in which everybody is valued. And it's often, from country to country, you come across tremendous levels of creativity. Again, an unusual example, and this is where I will end, this intervention. It's Western Nigeria in the 50s in terms of implementing, universal primary education, universal health care, investment in infrastructure. If you look at the education part, when they were going to introduce the thing, the government really didn't have much, and it was going to be a £1 tax per adult. But in the end, what happened was actually a partnership between communities and the state, in which many communities said, look, we will build the schools. You provide the teachers and the books. And I think the issue, it's not so much about money, it's about the capacity to think and say, these are the objectives we set for ourselves. Every child is valued. No child shall go to bed hungry. No woman shall die in child labor. And then we deal with how we actually, in the specific context, apply and do imagination. Mauritius developed a more expansive thing when it was purely a sugarcane economy. And it's flourishing today. But it's about the capacity to imagine, not this regressive notion about only the rich and the poor, so welfare coins nonsense, and the kind of urban legend that you hear in South Africa, about teenagers getting pregnant to collect 280 rand.
Michael.
Yeah, I just want to leave you with a thought which is very mechanic, but I try to do that everywhere I go. We need $600 billion US dollars per annum, technically, calculatorily, to close the absolute poverty gap, no matter where you put it, at the $2. I'm putting it at $2. You need $600 billion there, and to close the gap to the minimum set of acceptable health services. We have 60,000 billion GNI globally. And we have about 5 to 10 times that amount flaunting around the world in financial transactions annually. So if you do a simple math, you need between 0.1 and 0.2% tax on global financial transaction to actually fix a large part of the poverty gap that we have. I know that there are transaction costs, I know that's difficult, but at least there would be some sign of global solidarity. And it doesn't cost us anything that we don't have to give up anything for that, other than a few percentages of profit. So I'll leave it there.
Thank you. I think that's a very good thought for us to sort of wind up on. Just to very briefly, there's going to be a reception here. We have to move out of this room. I think we've finished. I think there's something afterwards. So you might have a few minutes to, ask your burning question to the panel. But I think we've covered a whole range of important topics that we need to sort of somehow bring into and continue the discussion about going forward. I think we've been warned against policy fads and the kind of traps that we get into, whether it's in our language, whether it's in particular policies, etc. We've talked a lot about different kinds of institutional arrangements. I think what came out of the conference, the workshop very clearly, was just, the complexity of institutions, institutional arrangements, the complementarities between different forms of institutions in developing the kinds of policy objectives we're sort of aiming at. And also, conversely, how easy it is, and I think Jimmy's pointed to some of these, but we see it in countries undergoing austerity, how easy it is to undermine the institutions that we've put a lot of effort into building up over a long period of time, and then it will take a very long time to rebuild them. So I think we have to be aware of these kind of processes that are going on. We've heard a lot about fiscal and tax, the critical issues there. We've also, I think, heard quite a lot about issues of citizenship, power, social relations, and governance in these processes, all of which are very complex sets of issues and very context specific. And I think this all points towards the sort of risks of aiming for too greater coherence in a very limited sense in terms of simple goals, simple targets that prevent us from engaging with the complexity. We've heard a lot about education, and I think there's no doubt, again in the workshop we heard a lot about the need for this kind of higher levels of education that lead to innovation and skills, and that's what we're really focusing on. Basic education is of course important, but it has to go beyond that if countries are going to become productive, more productive economies. And we've also heard about these debates that just keep coming back and won't go away, and I agree with Jimmy, we should try and get away from them, but at least now we have the IMF itself saying, actually, there isn't really a trade-off, according to the new evidence, between growth and inequality and growth and redistribution. In fact, redistribution can actually help, and through the mechanisms we've been talking about, investment in education, productive people, redistribution helps your growth. And if we can really reframe these debates very strongly in the context, maybe we can start making some progress in under the next development agenda and before. So let me finish there. Thank the panelists very much for, I think, some really exciting ideas. There's a lot to take away and think about. All of you for your participation and questions. The library again and their staff for making this space available. And we look forward to the next event where we see many of you. So thank you very much.